Hello, everyone, and welcome to today's Journal Club. Briefly, we'll be discussing a case report on mass intoxication reported in one of my favorite periodicals, the Morbidity Mortality Weekly Report. Also, the cartoon that accompanied the details for the Journal Club is really great. It's a painting that looks like it's from the Middle Ages, and they're drinking some homemade brew. With all the regulations that we have in place, it still feels like we live in the Middle Ages sometimes. Next slide, please. So it's awesome to have everyone that usually joins us for Journal Club to discuss this today. Dr. Phil Molloy, a rheumatologist who is retired but continues to be very active in caring for patients. Dr. Len Kamen from Jefferson University. He's the director of the Moss Rehab Outpatient Center, the president and member of the Pennsylvania Pain Society, and the head of the Rothman Opioid Foundation. And Dr. Jehan Marcoux, a cannabinoid researcher and the owner of Delaware Analytical Research Lab. Next slide. For those of you new to the program, I'm the CEO of Physicians Research Center Plus, and we have expertise that falls into three pillars: SALIS, which is really our phase 2 through 4 clinical trial pillar. We have Buds Info, which is our analytics and data collection pillar, and then Cerium, which is our education pillar, and that's what brings us to all these journal clubs to you. Next slide. So this, if you've attended before, you may have completed and scanned the QR code, but it would be really great if you have not yet to scan the QR code and take our survey, which is really designed to help understand, what you as a healthcare practitioner is important to you. It also asks you about some knowledge and attitudes, and maybe we can improve our program. So you can also check out our website, which is here. It's prc-trials-plus.com. All right, I'm going to turn it over. Next slide. I'm going to turn it over to Jehan, Dr. Marcoux, to kick us off.
Hello, everyone. The mission and vision of this journal club is to support the education of healthcare professionals with discussions of published research, and we do our best to approach each paper with consistency, fairness, and transparency. Please share wherever you get your information about webinars and journal clubs. Please share that with your colleagues who may be interested. We have the events pages posted on a variety of platforms. It's the same link every month. So thank you for those of you who made it today. We appreciate that. We'd also like to be clear in a bit of a declaration of journal clubs, and that the purpose is to educate, raise awareness, and engage in a professional exchange. We are not recommending any policy or regulatory decisions and have no, quote, skin in the game or agenda other than education. So we're picking articles to discuss. There's no real other sort of agenda there. So the article we're going to review today is entitled Tetrahydrocannabinol Intoxication from Food at a Restaurant, Wisconsin, October 2024, from Morbidity and Mortality Weekly Report. So some things to ponder as we jump into this is that these types of topics seem to receive a fair amount of media attention. And think about, I guess, some things pondering. Have you had, if you're a clinician, a patient, or maybe a colleague in your field mention accidental exposure to you? Does anyone you know, or a patient or a colleague, attended a mass intoxication event or traveled to a place known for cannabis celebrations? So some things to think about.
I'm going to answer one of those questions for you, Jehan. Yeah, my brother accidentally ingested, unbeknownst to him, cannabis product that someone had left on his kitchen table. Looked like a gummy, a candy. Um, he was sitting around at night, and it was a combination of high dose THC and melatonin. It was a sleeping product, and he took one and and then he was hungry and had 3 or 4 of them before he became very symptomatic. So these candies, they're not labeled individually, some of them. Just like a piece of saltwater taffy does not have each dose doesn't have a label on it. That's true for the gummies as well.
Right, and there isn't an app like there are for pills and other things that you can just scan and be like, "What is this?"
Right,
um,
right. He slept well that night.
well, I guess if that's what he was going for, then no need to report the adverse event. But
Yeah.
but why do we care about this? What is sort of the issue or problem? Is that accidental exposure uh, is increasing. These events are increasing. People who accidentally are exposed to cannabis products or THC or cannabinoid containing products. And part of the challenge is that some of these, as the events get bigger and more people are involved, they can mimic foodborne outbreaks, which affects messaging from media outlets, response from medical teams, and things like that. And so we see a lot of opportunities to strengthen the prevention of these unintentional mass intoxication events. And maybe there's opportunities for labeling or how do we respond to this? And is testing for THC now just part of the panel of like testing for salmonella or something when it comes to these events? Um, let's see. Phil, do you want to talk a little bit about some of these some of the numbers?
Well, for those of you who peruse the literature on accidental exposures, um, I am very impressed. I didn't count the number of reports, but with the number of reports that Poison Control Center in Colorado receives. So if you're an ER doc or a parent even, you can call the Poison Control Center and just look at what happened the second bullet between 2017 and 2021, a 4-year period. Look at how many kids, well, you don't see the numbers, but you see the percentage rise in accidental kids being exposed to products that look like candy to them.
And I'd like just to be clear here a little bit too is we have multiple ways that these products can get there, right? There could be perfectly well regulated products that maybe are taken out of the package and stored a different way, or they could be those regulated products. They can also be those very clear gray area products that are sold at gas stations and other places, or they can be just completely homemade or otherwise, obtained on the gray market or something like that. So I don't want to point any fingers at any particular company or regulatory program because these edibles and this accidental ingestion can come from a variety of market sources. All right, let's so on the next slide, there are, again, with all of these issues, there are similar root causes, mislabeling, so maybe some mismanagement of the product. There could even be contamination. There have definitely been instances where products labeled as being CBD had THC in them, and products labeled as THC actually had CBD in them. So vice versa, there's been these instances. But what I think makes this case in Wisconsin interesting is that it's not an individual or family setting. It is a restaurant scale event. So the location was Famous Yeti's Pizza in Wisconsin, and the cause was the use of THC infused oil mistaken for cooking oil in a shared kitchen. The foods that had the alleged, they think had the THC infused oil were pizza, garlic bread, and grinders, otherwise known as sandwiches. The police officially said it's accidental and it wasn't, they ruled that it was not an intentional um, contamination or adulteration with the cooking oil into the pizza place's food. So, Phil, do you want to go through some of the methods?
Yeah, I think as we were discussing just before we went live, there was a sentinel case reported in an emergency room in the town that this restaurant was in, where I'm not sure of all the details, but I guess things don't fit clinically sometimes. And the ER doctor suspected something and sent the tox screen to someone who had only ingested pizza, and the patient tested positive for THC. The patient says, "How can that be? I haven't used this," and is what triggered the investigation. All right, where did you eat this pizza, and so forth from there. So the Department of Public Health was called in. I don't really know who else was responded, but everyone who was known to eat at this restaurant was contacted, and you can see um, that there were 107 respondents, and 85 met the case definition, meaning having a symptom compatible with possible substance exposure after eating at this restaurant with in less than 5 hours. It, it's important, I think, to focus on time frame for a second. If you're allergic to a substance and ingest it, it's rather immediate to the point of anaphylaxis sometimes in the case of drugs. Food poisoning is hours to a day later. Um, gluten sensitivity, 2 to 8 hours. So the symptoms here were delayed were within the first 5 hours after eating food. That was part of the case definition. I think the authors decided that there was justification for an ingestible product. If you're going to get symptoms, it's going to happen within 5 hours. You can see the data that was collected, the environmental testing. Jan, can you remind me that oil was not available, right, at the time of this analysis?
So they did later on test the oil, but they used what's called, I believe it's pronounced the Duquesnoy-Levine reagent test. And this is a color changing test that if THC or other cannabinoids are there, it will turn, I believe, a purple color. The test has been widely criticized because while it will quickly turn purple if THC is there, it will also eventually turn purple if CBD is there. So it's sort of a quick field test, but that's what they used. They didn't quantify the amount of THC. They did a qualitative color changing test that is presumptive for THC in the oil, but that was after there were calls to from relating to exposure. So they probably so I think it was that once the patients one of the emergency department patients who showed up showed symptoms of THC intoxication, and that exactly what you said is that they had a positive THC result without having knowingly consumed THC, and that investigation basically sort of was non-research public health surveillance, and so there wasn't like they basically kind of stumbled upon this thing by just piecing things together. This person ate pizza, they didn't feel well, they looked a little high, and so they said, okay, we're going to just throw a screen at you, see if maybe you accidentally were exposed to something.
Jahan,
Right.
they never got the recipe for the oil from the company that actually synthesized this oil, this canola
Oh,
oil.
well,
They never got back to them and said how many milligrams per ml or per how many, how they use this in making their gummies or whatever products they made from it.
that is 100% correct, because the reason why this got mixed up is there was a shared storage area and kitchen for a facility that makes cannabis infused products in Wisconsin. And I don't know if this app is working, but you should be magnifying the label. You can see that in a busy pizza place, you run out of oil, you walk into a place. Does that say cannon oil, canola oil, cooking oil? Like, what is that label? I don't even know if that date is legible, 24, 26, 25. Or maybe that's a use by date. Maybe that's June 24th, 2025. The label has a lot of interesting initials and yeah, things like that. So this is the actual product in question, the vat. And again, we really don't know anything about the amount there, just that there was enough cannabinoids to trigger a positive Duquesnoy-Levine color changing test for.
and to cause illness, clinical illness. To me, this label, it's not hard. It's not a stretch to say that's D9 delta 9 cannabis oil. It's not a stretch.
Yeah.
Although at first glance, if I was a restaurant worker, I would have said um, canola oil too.
Absolutely. And that's where
Yeah,
I think it was really easily mixed up. The D9 could be 09. We can't really see how clear.
yeah,
And when you're cooking pizza, you're not thinking cannabis most likely. You're thinking, oh my God, we don't have any oil. We got a lot of restaurant people. We need, it says can oil. Maybe not everyone speaks English. Like, who knows, right? I mean, when you're in a restaurant, you're quick. It's a quick decision. Definitely
yeah.
could be mixed up, I think.
Yeah,
For
not
sure.
everyone may be a weed aficionado and
That's right. That's
understand
right.
I,
shorthand, you know, writing. And I think we'll come back to the timeline in a second. We did
Yeah,
have
so some of our we get like, some of our comments are great, but the smell, that's true. I mean, like, you would think that maybe it would smell differently, but
and we didn't get an estimation to questions in the group chat. We did not get an estimation of the dose in each pie or serving, so we don't know. Did they put the oil in the dough and they just put, a cup of oil when they mix up each batch of dough for the various things? Like, I'm unclear how the grinders, the sandwiches, had the canola oil in them. Like, how do they use it to cook the meatballs or something? Like, I'm
well,
just.
I probably use it in all the dough. So there's a dough recipe that I know I use that uses a small proportion of oil. And so if that's the case, if they use that, then that oil goes into all their dough. And okay, and so like oil and vinegar drizzled, like there we go. So we have
So
so
Teresa's laughing at the group comments
I
here.
am, I
She's
am. I'm
watching
laughing at the
this.
group comments because they're all true. They're all 100% true.
Yeah. And there was no comment, if I remember. It's been a while since I read this report. I don't think it, smell was addressed when somebody grabbed this oil.
That's
There's
right.
no
I don't think
odor.
smell was not
There was no
addressed.
odor comment.
I think that
But
the garlic nuggets probably overwhelmed
And we have to
the
yeah, but
remember that a lot of the terpenes found in cannabis are found throughout nature, including in things like oregano, basil, and other herbs and spices.
pepper.
And the ability to identify cannabis has been kind of, just by smell, has been rejected in the literature and by the courts. So um, it could be a perfectly legal smell. And like you said, just the sheer amount of garlic, basil, and oregano in the room they just be like, oh, I guess you got some really fresh oregano today. Like, who knows?
so in retrospect, we can focus on how could local zoning people allow a co-op, like a strip mall co-op, with a cannabis dispensary and a restaurant to have a co-op kitchen, a shared
And
kitchen.
and, and this product isn't secure. Like, I think that's
Yeah,
look, hey, if you're operating like a cannabis testing lab, I can't just leave out a bunch of like THC laden anything. It goes in a safe, and we're not even like selling products. We're testing products. We have standards and stuff. All that stuff is under lock and key, and so it feels really wild. And I can't think of any jurisdiction I've gone to that has a regulated cannabis adult use market where anything like this would even be allowed, because in most states there's cameras 24 hours a day in any room where THC is being held. And we have a participant who's informing us that Wisconsin is not medical or adult use. Phew, this is hemp. So there's probably, let's see, if you have 0.3% THC by weight in a couple gallons of canola oil, all right, so you got like what, several thousand milligrams in there, maybe way more. So that's probably a very, very potent oil if it's 0.3% by weight. So that explains a lot. So Wisconsin is neither adult use or medical cannabis. It's purely the big beautiful hemp farm bill. Whoever signed that in the law, I don't remember, which allows you to do these sorts of things.
Yeah.
They don't have to label the potency because as long as it's 0.3% THC by weight. So we can come back to this lovely image, but we can move on to the timeline a little bit just for clarity. There we go. So I feel like I'm in like one of those crime shows, like restaurant runs out of oil, 2 p.m., October 2026. Dun, 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 dun. So they have a neighboring kitchen shared by multiple businesses, including a vendor of edible THC products. Restaurant serves item made with THC containing oil. Emergency services transport 7 persons who ate food from the restaurant to the hospital. They test people for carbon monoxide, which is negative. And basically, they receive a self-report of a person receiving a positive test result after eating at the restaurant. And that leads to an on-site visit. The restaurant closes. Police conduct on-site investigations. And the oil from the shared kitchen tests positive for THC. And so basically the press release goes out, social media posts come out about the contaminated dough, and the outbreak survey opens. And I think that was one of the more interesting things about this is one of their approaches was to put out a survey and have people fill out the survey. And then just really quickly, the restaurant reopens. And then even though the restaurant open, people are like, don't eat the dough, it has THC in it. And then basically the outbreak survey closes. So this is all handled a little bit in about a week, which I think is pretty remarkable.
They might have had lines around the block. Who knows?
I mean, maybe this is a great marketing stunt.
Yeah.
So I just
So
Yeah,
want
yes,
so
I
I,
think, Jahan, you're going to get into, I think, in the coming slides about, so like the intention, right? So they weren't charged with anything because, I think that's important. Like it was an accident. Um, so it would be a pretty bad prank to do something like that if it was intentional, right? Um, so we are assuming best intention, similar to what I think the authorities also assumed was that it was accidental.
And I would like to share something. I was doing a calculation here, and if you look, let's just assume there was a gallon of cooking oil. It's probably more than that, but let's just say it was 1 gallon. And you're allowed 0.3% THC in there. That would be over 11 grams of pure Delta 9 THC. Not milligrams, 11,000 milligrams would be allowed in that. And again, they just did a canna color test. So much like the comments coming in the chat, yeah, it could absolutely have been a Delta 8 or one of the other less studied derived cannabinoids. I mean, this could have just had a small amount of THC in it and had a whole cacophony of the derived THC isomers, because the Duquesnoy-Levine test that they use is, as I've testified in court about this test being used to identify products, it's completely unable to differentiate between cannabis and hemp products. Because it just turns color in the presence of cannabinoids.
Right, it's a positive or a negative. It's probably like a quick test when you're out in the field.
Yes. So it would have been better if they had a regulated market and could have sent it to a lab, but we will never know really what was in there. We only know that there is something THC-like in the product. So here's a table of results from the online questionnaire filled out by 85 people. And we can see that there's a variety of things reported. Now, again, this is an online survey, which, again, is limited by the methods of online surveys and recall bias and things like that. And if you asked me if I was anxious, 3 days ago, I'd probably just say yes. Have you been tired since you ate pizza? Yeah, I might rate. Um, but I think they started to ask some better questions. Feeling high, drugged or drunk, and down here in these lower sections, dry mouth. Some interesting things, allergy-like symptoms, confusion. It goes on down. Even suicidal acts on the bottom, which isn't necessarily well defined or defined at all in this study. So, how would you rate your impaired driving? I mean, we know that human beings are very poor at rating how well they drive. I think that this is always why you have to be difficult as a backseat driver, is because they always think they're driving well. um, but I think individually, not many of these are very convincing, but I think collectively they add up to indicating that this is a mass intoxication event of some sort, or an exposure to something, some sort of substance that is, interacting with a physiological system that is different than the normal bounds of the daily operating of your body. So and I'm more than happy to go back to that table if anyone would like to look at it. But
Well, it's interesting to me that head and neck pain was substantial, 10%, 9%, 10% of the patients.
yeah,
Yeah,
That's why head pain. I think differentiating those two might have been a better idea. Headache
yeah,
versus neck.
yeah.
and just anything above the shoulders that was bothering you.
Yeah.
And how do they define the pain? Right, it's just a general thing.
This is free text response.
Right, right. They didn't
Yeah,
include headache in their
yeah,
solicited questions, so which is interesting, right? Because
yeah,
people may have ticked that off
yeah.
as an option if it was there. So I suppose that they put the free text head or neck pain. Some
Right,
people may have said head pain, not really
right.
like thinking that it's a true headache. It's interesting, Dr. Kamen, yeah.
Yeah,
Yeah.
To summarize some of the high points of the epidemiology, so we had 85 confirmed cases, 1 to 91. The symptom onset was about an hour, ranging, upwards of 5 hours. And objectively, I would agree with the authors that this cluster resembled a foodborne outbreak of, some sort of contaminant. The main things reported when they were prompted were dizziness, sleepiness, and anxiety. Other symptoms, notable responses were tachycardia, nausea, ataxia, and hallucinations. Um, I wonder about the hallucination thing because I don't know how common that is, and even in clinical settings when people are given injected THC, you don't often see that reported at all. So it makes me wonder if there were other things in there. 33 sought care, 3 were hospitalized overnight. No fatalities. So we got a comment. 22% of the people admitting to hallucinations is significant. I want to go back and look at that again. Yeah, so 22% of the or 22 respondents said that they experienced hallucinations, 25.9%. 62% said no, and 11% were not sure whether they were hallucinating. They're just going about their day semi-conscious. They're not really sure what's happening at any given point.
Some And some people don't know what hallucinations are.
True.
Yeah,
I mean, it brings up a lot of philosophical questions,
yeah.
but that is significant to me, and I wonder what, uh, like ChatGPT, one of our participants said. That's hilarious. Um, so I wonder, what they were defining as hallucination. Would it just be the feeling of increased blood pressure or the short-term impact on memory
Yeah,
they were calling a hallucination? Because maybe
yeah.
time distortion is a form of hallucinating. We don't really.
That's right.
Yeah,
So
and
when
if
they say solicited, those are actual, the terms that they included in the questionnaire verbatim, and you had the option to say yes or no. And then your free text is they allowed other, a checkbox that would say other, and then you could write in what you actually felt. I'm sorry, Dr. Kamen, you
well,
want to say something?
yeah, well, the perception distortion in the free text also has a footnote to it, I think. And I don't know what that is, but perception distortion and hallucinations are one and the same, I would gather for most people.
All right, let me. I will look at that. That's a good point. But the good news is, it did not affect anyone's work. Only 3.5% of respondents, despite hallucinating and feeling drugged, they it didn't affect their work. So that's.
Sure.
Yeah, they were air traffic controllers. Yeah.
So let me look up that real quick. I have the paper here. And Len Kamen, you were asking about the perception distortions.
Yeah.
Yeah.
So that note is examples of terms used by respondents to describe perception distortion included false sense of reality, psychosis, felt like being in a dream, heightened hearing, and having an out of body experience. I mean, it could have been just massive doses of THC compound.
Well, I think that counts for individuals saying this is hallucination, either auditory or visual or distortion of perception. I think that's perhaps a better term for the hallucination, which is perhaps relegated to what we know as psychedelics.
But these people answered the questions. They were primed. You have been exposed, you've been potentially exposed to THC. We suspect this poisoning. Do you have any of these symptoms? So that's different than a randomized blinded question.
Yeah.
Yes. Um, yeah, the survey, one of our participants here said, survey, have you seen any pink elephants since dinner? That's amazing.
Yeah,
Well,
and
that's
so
what I
that's
saw with
very true.
64. Yeah.
So Dr. Muller, you bring up a really good point as well, in that, when you know what you've been exposed to and what you have like thoughts about that may occur if you've never used cannabis before, you may write something
Yeah.
thinking of
It's
something
like,
else, right?
oh my God, poison control is just calling me. The police department's here. They're asking me to fill out these questionnaires. There's
Well,
been
but if they
poisoning.
say what they, and I'm going to go back and read it. I did look at it
Yeah,
again this morning, but I'm going to go back and read because the design of questionnaires is so important when you're doing
yeah,
something like this. It's incredibly
yeah.
important about, leading questions versus trying to, and so if they know what they were exposed to, because they did eliminate like over 100 surveys because of
Right,
that, right? Because they got some,
right.
not good quality, information. But so yeah, so questionnaire
It's
design is critical, and knowing if you're exposed to something will bias the results.
not to take away from, it's very difficult to respond in real time in less than a week to collect all this data.
Absolutely,
And, and
absolutely,
I don't know if you called me and said there was a possibility where you ate last night, you were poisoned with something that was related to a drug or something, I might answer questions differently than if you didn't say.
for sure, absolutely. I know, because you really think about how you felt.
Yeah, yeah.
Well, um, moving on to the thoughts about the public health response or responses, survey and public health alerts. Hey, don't eat leftovers from this restaurant. Don't eat the dough because they used THC oil in it. Um, the response was to close the restaurant, clean everything, and reopen it after a clearance. I think
But they
this is
don't say that improved labeling of other products was also
No.
recommended, right? I
Or
mean,
we're not sharing our kitchen with this company anymore.
okay, that's what they said. They're not sharing the
Yeah,
or
kitchen.
maybe don't put the THC laden products next to identical products, right?
yeah,
Yeah, they're not sharing the same storage.
Yeah, just I think that that's probably a simple thing.
yeah.
We will not know what those responses are. We don't know. I mean, I imagine if you were a business, you'd probably be pretty upset if this happened to your business, I guess. So I'd be wondering what's happening to the THC product vendor. We don't know.
Right.
So we've talked about a lot of questions. How might we identify accidental exposure instances? How might responses to accidental versus mass intoxications be different? How should clinicians respond to clusters of unexplained impairment? And do we really need more laws and regulations to address this? And how likely was this event in the first place? And could it happen again? And I think that statistically speaking, it happening again is something like this happening again is not much of a stretch, really. I think it might just be part of the growing pains of a regulated industry. Things will be taken to minimize it, but I think we're on the precipice of consumption lounges, of events where products will be sold. But I think these events over time will decrease because as consumption lounges and things like this become more common and normalized, I think everyone's going to have prepackaged products that are clearly labeled, much like beer or other spirits, like and things like that.
Dead fat of oil, though, is prior to labeling. That's raw material ingredient.
Absolutely. So I think there,
Yeah.
um, I mean, I wonder if the THC vendor ever made placebo products. 'Cause-
Yeah, and there's a comment in the chat that there's probably no testing labs to send this to. So, I mean, I think that, what are the regulations around testing hemp, right? And when and hemp oils and stuff that someone may buy or make themselves to use in products that they're selling.
Yeah.
Right. Well,
So,
is the law that is the regulation or accepted standard that you just need a certificate of analysis to accompany the product, or that you actually have to get it tested? So there are plenty of labs that people can ship these products to out of state, but many people tend to rely on certificates of analysis for a product that are several years old and maybe even several harvests old. So there is a bit of an issue with the reliability of the hemp certificates of analysis at times. But again, with more, say, fastidious business owners, they do keep really good records and they want to know what they're receiving. But there are testing services available, just not in the state. They'd have to send their hemp sample out of state to a qualified hemp lab.
so Jehan, in the manufacture of these oils that are again low THC or the 0.3%, as you said, is there first of all, how do they manufacture this? There must be a standard for it. The manufacturers or the distributors know they'll get busted if they are tested more than the 0.3%. So there must be a
So
standard of how they manufacture this.
this is a great topic. So if the heavier the product is for hemp, the more THC you can have in it. So I could sell 20,000 milligrams in a hemp gummy as long as the hemp gummy was big enough so that 0.3% of its weight. And indeed, there is a group that sells a party gummy that has over 20,000 milligrams of THC in it. I think they even make one that has 30. So this is a big issue in hemp because of the weight thing. There are ways to gain the system, and so liquids like water or oil are some of the most dense and heaviest things on the planet. I remember that from my Boy Scout days because you used to have to carry water, and it was like carrying like gold bars. It was so heavy because it's dense, right? If you think of flowers, there's a lot of air pockets. It's light and fluffy. You can't fit a lot of THC by weight on there like you could in a liquid because again it's by weight, and so I wouldn't call a 0.3% oil or any liquid low potency. I would actually say it's higher potency than anything you can get at a regulated cannabis dispensary.
Jehan, do you know if all the hemp-derived products you can buy on the internet right now have to go through testing?
um, at some point they are required to go through testing through larger marketplaces. There are more strict requirements, but no, in no way for cannabis with a big C or marijuana with a big M, uh, those require very strict testing standards for THC. For hemp, it's just 0.3% dry weight of the plant material, usually how it's interpreted, depending on the jurisdiction. And then that can be turned into anything you want. So
So,
there aren't like testing along like the finished
yeah,
product typically is not tested in for like hemp flower. It's
all
tested
right.
at the time of harvest. And it's not because, you know, and that's those are just wonderful legal loopholes created by a well thought out program for intoxicating cannabinoids. And that's really what that is the result of is um, creating this other marketplace where there is no testing, it's buyer beware, and things like that.
Well, I'm gonna stop into some gas stations and buy products and send them to a lab I know
I
for
recommend,
analysis.
yeah, those labs can be expensive though, so you know, make
Yeah.
sure. um, so the authors, I'll get off my hemp box here about the different regulatory programs. If you're interested in reading more about that, I did write a book chapter about the FDA's role in defining cannabis and hemp, and it's available. That book is available on Amazon. Uh, the authors concluded a co-localization of food establishments with businesses that make THC infused products increase the risk that a THC containing ingredient might be added to food either intentionally or unintentionally. I think that is pretty sound. I think we all would agree with that conclusion. And I think the incidence greatly increases when, you know, the products aren't separately stored or adequately labeled or clearly labeled. And just in the interest of time, moving through a little bit quicker here on some of these slides, but you're welcome to chime in, comment. You can unmute yourself if you'd like to ask some questions. I know many of you have been submitting comments into the chat. We appreciate that. Um, so some of the key lessons is how do you know, diagnosing this? Do you think cannabis when multiple diners report dizziness and anxiety, or do you think foodborne illness? Um, there could be prevention steps to separate infused versus non-infused products, maybe stricter labeling and storage practices. I really like their outbreak tools. You know, as much fun as it is to look at open free text surveys, I thought it was very interesting and informative. And I think something would be, it doesn't seem to be used widely in the cannabis space, is sort of these types of surveys. Shared kitchen risks, maybe there needs to be better policies just for these kitchens. A few simple policies I think could greatly improve things, and perhaps labeling standards. I mean, good Lord, we have so much labeling for pine nuts and tree nuts and the, you know, other allergens. Um, Thinking about this for THC is it's just like we've handled this before. This is not something new, and just being a little bit more forthright about what's in these products. And there is a lot of research and active experimentation going on in this area. You can find lots of articles about emergency room visits during 420 events. There's an article came out about 5 years ago on that. There's reviews of passive exposure. Last time I went to a concert, I actually was about to sit down on the grass, and the couple next to me leaned over and said, "Excuse me, you're not going to smoke marijuana, or you're not going to smoke weed, are you?" And I was like, "No," and so they let me sit there. But everyone around us was smoking weed, so it was really kind of there's lots of passive exposure these days. There's also a lot of unintentional exposure and things like that. And there are also intentional exposure events. The Seattle Hemp Fest going on since 1991, the Michigan Ann Arbor Hash Bash since 1972, Vancouver, there's Spanibus in Spain, there's tourist destinations like Jamaica, the Netherlands hosts the Cannabis Cup, California has Cannabis Cups, there's state fairs now with cannabis competitions in them. So this is, I think, intentional, maybe responsible use of these products, public use of these products is not going away anytime soon. And having these discussions is very important to make sure we have, those small changes to policy that push things in a right direction that benefits the most people possible. All right, so we're nearing the end of the road here for this journal club. If there are any other comments, questions, observations people would like to share, I encourage you to just unmute yourself or throw it into the chat. But we will end here potentially just by saying that our next journal club, Tuesday, November 4th, this same link, same bat time, same bat channel, we'll be discussing basic research, an area of research near and dear to my heart, and we'll be looking at what the authors call chronic cannabis promoting pro-hallucinogenic signaling of the 5-HT2A receptor through the AKT-mTOR pathway. The 5-HT2A receptor is a type of serotonin receptor and is also the target of things like psilocybin and LSD. Should be a really interesting basic research talk. And we look forward to hopefully seeing some of you there. All right. Well, thank you everyone for attending. Appreciate all the participation and discussion in the meeting chat, and look forward to seeing some of you real soon at the next Journal Club.
Yep,
Thank you.
Shannon had an interesting, just to take note, Jehan, for future. She had some interesting comments. If you want to like somehow get that out,
Oh yeah.
save it.
We did
Yep.
talk about a lot of them, but
Yep, exactly. Okay. Thanks, everyone.
Thank you. Have a good day.